Welcome to the Dr. Jim Cares podcast with Dr. James Augustine, where we provide powerful solutions for helping you create wellness. Join us as we talk about all things holistic and functional medicine, including, but certainly not limited to, diet, nutrition, and herbs, as well as the latest lab testing and cutting-edge technology to improve and maximize your wellness. Disclaimer: the following discussion is for educational purposes only and is not meant to diagnose or treat disease. Because our approach is individualized, it is important to not apply this information without first consulting with your healthcare professional. And now, here's Dr. Jim.
Welcome back to the podcast. My name is Dr. Augustine, and today we're going to be talking about a special testing technology that I like to fondly call the heart scan. It's always been my intent to provide you with amazing cutting-edge technology and testing so that you can discover health challenges that are developing before they become a crisis. Today we're going to be talking about what is a coronary artery calcium test, how I actually discovered it, who should do the testing and why should you do this testing, and when you actually have plaque in your coronary arteries, what can you do about this? So let's get into it. What is a coronary artery calcium test? First off, it's a CAT scan of just your heart. So it's minimally invasive, but it demonstrates how much calcium and plaque is forming in your coronary arteries in your heart. Special artery called the left anterior descending artery. It's the main blood supply to the left ventricle in your heart. And if you happen to have a heart attack because of this artery, 80% of the time you're going to be absent from the body and present with the Lord. So you don't want to rush that. It's not a good thing. So this scan is really, really amazing. I discovered it literally about 20 years ago. And I had a patient who was a 60-year-old gentleman who had lower back pain. That's why he came in, but he had a history of smoking, skinny as a rail, really skinny little guy. But we did lower back x-rays, and his lateral lumbar x-ray demonstrated calcification and plaquing in his lower abdominal aorta. So I said, if you have lots of plaque there, you're definitely going to have a ton of plaque in your heart. I said, let's do this particular testing. Did the test, results came back, and oh my goodness, this guy was loaded. Severe everything. It wasn't just in his left anterior descending, it was all of his coronary arteries. So at that time, I said, okay, we got to get you to a cardiologist, bring this information, bring this testing with you. He goes there, finds a cardiologist. The guy listened to me, it was great. Goes to the cardiologist, shows him the results, and the cardiologist said, oh, that's a bunch of garbage. Here, we'll do my stuff. Don't worry, I'll take care of you. I said, get a second opinion. He does get a second opinion. And then this guy immediately scheduled him for open heart surgery and actually ended up saving his life. He's still alive today. Now today, I don't really recommend doing open heart surgery because there's other ways that you can start to deplaque your arteries without having to do open heart surgery, which is what I recommend. Another side note, there is a movie on YouTube that's called The Widowmaker, or Widowmaker movie. I suggest if you're interested in this, that you take a look at this because it really gives you a great perspective of this technology and why it's so essential. Now, this coronary artery calcium has a scoring system. It's called an Agatston score, Agatston scoring. So if your score comes back and it's basically from 1 to 10, you have minimal presence of plaquing in your artery. 11 to 100 is more mild coronary artery disease. 101 to 400 is more moderate plaquing. And over 400 is more extensive plaquing. And I've had many patients with scores of above 1,200. Even one person was 1,800. And so we've been working on this person with great results. So it's just a CAT scan of just your heart. There's no invasiveness, no injections, that sort of thing. They do hook you up to a 4-lead EKG. And the reason that they do that is once you lay down on the table, it's so that people get nervous when they do testing, especially in a doctor's office, that sort of thing. But it's an imaging center that does this. They lay down on the table, they hook you up to the EKG, and it's so that your heart isn't beating too fast to blur the image of the CAT scan. That's really it. You lay down there, you're not in a tube, so you don't get claustrophobic. It's like a giant ring, so it's very, very open, so people don't have to really worry so much about being claustrophobic, that sort of thing. And you get the image done. Literally, the test can take you half hour to 45 minutes at the most. You walk in, you walk out, and we will get the results very, very quickly within a day or so. They hand deliver the results right to my office, which is great. Plus, I also get access online with that. So who should really do this testing? Since heart disease is still the #1 killer in the United States, I suggest that everybody does this testing. The reason being is 1 out of every 3 people has pre-diabetes, insulin resistance. And some really amazing and current research is this. LDL cholesterol. Everybody's worried about their cholesterol. Matter of fact, cholesterol-lowering medication is the #1 seller today. And cholesterol doesn't really cause the problem. And this is why. This piece of science says that what happens, imagine your cholesterol is being sent out by your liver, your LDL cholesterol, supposedly the bad cholesterol. It's sent out by your liver to go put out inflammation and repair tissue, that sort of thing. It's also essential for your immune system. It's essential for hormones, for your brain. It's really essential stuff. But what happens if your cholesterol gets really sticky? So the analogy, the great example is, imagine that you have tennis balls and you're throwing the tennis balls around a room and they bounce off the walls. And we're talking about cholesterol particles going through your blood vessels. And if there's no stickiness to these particles, then there's not a problem. However, guess what will make your particles very sticky? And it's insulin. High levels of insulin will make your cholesterol and particles sticky, whereas they can stick to the walls of your arteries. What's insulin involved with? Well, that's involved with prediabetes and diabetes. So really, really critical overall, and we'll talk about this later when I get to what to do about this problem, is we have to get your insulin level low. We have to get your blood sugar back into balance. Really, really critical lifestyle factor that can cause problems and or reverse and prevent problems from developing in your heart. So who should be doing this testing? I would say people that are from the age of 30 on up should be doing this testing, especially people that do have blood sugar issues. Whether you know it or not, really important testing, blood test, would be a fasting insulin. Fasting insulin, not just cholesterol, not just a metabolic panel, but do a fasting insulin. Not just a hemoglobin A1C test, because that can be totally normal and fine, but your fasting insulin will show that your insulin level is really, really high. That's a problem. Why? Because it's like putting Velcro around your LDL particles, makes them very sticky to the sidewalls of your arteries. Not good. So checking blood sugar. If you have blood sugar problems, you go throughout a day and all of a sudden, you have this energy in the morning, and then all of a sudden it dips throughout the day. Or if you sit for too long, you're sitting at church and you start to doze off. Indications of insulin resistance, prediabetes. And remember, 1 out of every 3 people is prediabetes or insulin resistant. Insulin, critical factor in this. What do you do if you do this testing and you have a bunch of plaque, or you have a little plaque forming in that left anterior descending artery? Here is the protocol from a deplaquing perspective, from a nutrient or an herb perspective. Number 1, maybe you've heard of vitamin K. Well, vitamin K2, the MK7 fraction in the science, has demonstrated that it deals with calcium metabolism. So it helps to start to deplaque things. Colaplex, it's a liver cholesterol supplement to help your liver normalize your cholesterol levels. So supporting liver is a really, really critical factor in this process from a nutrient perspective. Now, does this take the place of your cardiologist or your MD? No, it doesn't. This can be done at the same time, because this is about getting your body healthy, getting your body tissues to heal and have optimal function. It's not treating disease. Another product called Ceruta Plus. I love this product. Saruta Plus. It's a special type of whole food vitamin C complex that has more what's called rutin, R-U-T-I-N, rutin in it, that tends to heal up the inner skin lining of all your blood vessels. Inner skin lining is called endothelium. That's that inner skin lining protective inside your arteries that can get damaged from blood sugar, insulin, and cortisol being too high. Those three are high in your blood. It's corrosive to your arteries, causes damage to them. Saruta Plus, lots of it. It's really, really good for you. Vascular Care Complex. It's exactly what it sounds like. It's a blend of herbs that helps your vascular tissue. Cellular Vitality, and the reason for Cellular Vitality, this is a particular supplement. The listing of supplements that I'm talking about really come from Standard Process MediHerb. Cellular Vitality has high levels of naturally occurring coenzyme Q10. Coenzyme Q10, great for heart and cardiovascular function. Now you need a fish oil. Oprima EPA DHA is a fish oil that tends to be very, very anti-inflammatory and very cardioprotective, heart protective. Magnesium, another mineral that's really, really essential to blood vessels, opens them up, dilates blood vessels, relaxes the musculature in your heart and your blood vessels. So magnesium, really, really important. And another thing that I've added in actually is gymnema. It's a great herb that works on insulin regulation in your pancreas. Metabolic complex helps to restore and balance blood sugar. Wonderful, wonderful products. Normalizes insulin. Now, from a lifestyle perspective, what should you do? Very low carb eating, even ketogenic diet would be excellent because you don't have a lot of starchy and sugary carbohydrates in that. Why? Because you want to keep your insulin level low. The lower you can keep your cortisol levels, your insulin, and your blood sugar, the slower your body's going to wear out from inside out. Really good thing to do. So remember, ketogenic diet for insulin and then that stickiness factor that can occur in your LDL cholesterol. That being said, the summary is great scan, amazing scan. Everybody should do it, especially if you're 30 on up and you've had any sort of history of blood sugar problems. Even if you don't know, this scan is $99. Anybody can afford this scan. Great scan to do to make sure that your heart is fine. You can be slender, like this gentleman I told you was 60 years old. He was a skinny guy, and yet he had tons of plaque in his heart, in his blood vessels. So how much you weigh doesn't really matter in this perspective. So get the test done. Great test. If you don't know or have a location or a doctor that can do this test or order it for you, let me know. My name is Dr. Augustine from Head to Wellness. I'm on social media, Instagram, TikTok, as well as YouTube. You can also find me on Apple Podcasts, Google Podcasts, Spotify, and some others. You can email me at draugustine@gmail.com or call me at 562-860-3404. My office is in Buena Park, California, which is about 40 minutes from Los Angeles, maybe 10 minutes from Disneyland. I'd love to hear from you. Thanks so much for watching. And also a shout out to a gentleman by the name of Ivor Cummins, I-V-O-R, Ivor Cummins, if you want more information on this wonderful test. Thanks for watching.
Thank you for joining us on your journey to wellness. If you'd like to meet with Dr. Jim in person or on Zoom, you can find him at his office, Head to Wellness, in Buena Park, California. Give him a call at 562-860-3404 or email Dr. Jim at draugustine@gmail.com. That's DRAUGUSTINE@gmail.com.